I'm Garrett Levy-Meeks. I'm a family medicine physician at the Bay Area campus. I was actually interested in Kelsey-Seybold since I knew I was going to come to residency down in the Galveston area. My wife was a public health major in college, and so one of the projects she did was learning about various different types of structures that healthcare can take, and then I kind of piggybacked off that and did my own research. And one of the structures that I really liked was the capitated structure, because it takes the onus off the physician to order 100 chests just to make sure that they actually get compensated appropriately. And of course, in the US, one of the big examples of that is the Kaiser system, but unfortunately there's no Kaiser in Texas. But after doing a little bit of research, I found that Kelsey-Seybold not only predates Kaiser, but runs on a very similar model. And so after that, I was very excited to try to work with him. And then when I graduated my fellowship and I saw that they were looking, I jumped at the chance, and here we are. I like family medicine because at heart I'm a Renaissance man. I like doing a little bit of everything. And I grew up in the middle of nowhere, Texas, and I was one of those sick children with tonsils the size of their fists, and I was in and out of his office all the time. He was an old country doctor, and he'd tell me stories of delivering babies in the back rooms of farmhouses and having to amputate hands in the field and taking care of whole villages and these things back in the 40s and 50s. And so that was kind of my idea of what medicine was. Then medical school rolls around, and they're like, well, you have to take all these certain subjects, and you have to do all these certain rotations, and then you'll find what you like. But the trouble was, every time I did something, I was like, man, I really like that. And at the end of third year, I was like, I just kind of like everything. And so then one of my close advisors in med school, who happened to be a family medicine physician, was like, well, just do family medicine, because then you can make of it what you want and do what you want. And so here I am, and I've enjoyed it quite a bit. A couple of selling points. One, compensation is always something that we care a lot about, because a lot of us, especially as we're starting our career, have significant amount of debt. And one thing that I truly enjoy at Kelsey-Seybold is that hard work is truly rewarded. And I think it's rewarded in a very fair way, that the harder you work, the better you're compensated. And it's not some percentage base or complicated formula. And they're very upfront with that. And I've seen the fruits of my effort in a way that some of my other co-residents in various other institutions have not seen. So that's number one, what I appreciate. Number two, having worked and rotated within various academic and non-academic institutions, the multi-specialty group experience that you get at Kelsey-Seybold is really something special, because you don't see a lot of groups this big with this many different specialties outside of academic settings mostly. And in residency you get used to like, oh, let me just call my ortho friend, or I'm just going to shoot you over to derm real quick. And in the real world, things don't work quite that fast. But here at Kelsey, they do, and I'm able to get my patients in, and I'm able to get them seen by the appropriate specialist. And even better for everyone all around, if I've got just a quick question, I need a side consult, I have a whole host of people that would prefer to answer a quick question for me, so that we save a visit for us, for them, and for the patient. Come join us here at Kelsey-Seybold. Everyone's welcome. We need you, the patients need you, and we have a lot of fun.